My name is Kayla, and I will be presenting ovarian cancer. Ovarian cancer is uncontrolled proliferation of abnormal cells in the ovaries, fallopian tubes, or peritoneum that forms a malignant tumor. If you look at the image of Figure 1, the ovaries are the reproductive organs in women that are responsible for producing eggs and secreting hormones during their lifetime. Women have 2 ovaries that pass the eggs to the uterus through the fallopian tubes. Types of ovarian cancer include epithelial, germ cell, stromal, and primary peritoneal. Epithelial concerns the epithelial tissue of the ovaries or fallopian tubes, and germ cell deals with cells that give rise to the eggs. Stromal ovarian cancer is indicative of connective tissue cells, while primary peritoneal concerns cells that are native to abdominal and pelvic lining. This presentation will go further in depth of an epithelial ovarian cancer subtype high-grade serous carcinoma. HGSOC pertains a highly aggressive nature at oftentimes when it is too late. When focusing on our geographical location of the United States, there is about a 1.3% expectancy rate for a female to develop ovarian cancer during their lifespan. Because prognosis is frequently delayed, the average age for an American woman to get diagnosed is 63 years of age. With HGSOC's behavior, it leads mortality rates out of the other ovarian cancer diseases with a 70 to 80% mortality rate. This means that out of all ovarian cancers, it's least likely to survive high-grade serous ovarian carcinoma. Another reason why this epithelial carcinoma subtype is difficult to beat is due to its tendency of relapse. Typically, there's a 5-year range where uncontrolled proliferation begins again, and with that being said, long-term survival is considered to be 10 years, as 75% of women affected cannot withstand 10 years of these conditions after being diagnosed. The odds of long-term survival are tremendously rare, obtaining a rate that is less than 10 to 30%. If you get diagnosed early, you have a 55% survival chance, and if you get diagnosed late, the rate decreases tremendously to 15%. American women generally face their initial diagnosis when they're 63. As women age, the likelihood of facing this incidence increases. Geographically speaking, high-grade serous ovarian cancer in the United States is moderately seen when compared to other regions. Asia and Africa tend to have lower instances, whereas increased instances occur in Northern and Eastern or Central Europe. With that being said, Caucasians or non-Hispanic individuals are at a greater risk of developing epithelial ovarian cancer in their lifetime. This means that African American, Asian, and Hispanic women are less at risk. Risk factors generally associate with lifestyle and genome complications. Lifestyle factors include a woman's desire to have children and reproduce, then breastfeed, which having children mitigates risk, and so does breastfeeding. Women with irregular menstrual cycles have a greater risk since they're experiencing a greater than average number of ovulatory cycles during their lifetime. When women choose to take hormone supplements, it can reduce their risk to up to 30%. Genetic mutations seen in BRCA1 and 2 have been correlated to HGSOC as well as TP53. These both have key involvement in homologous recombination. Of course, if you have a family history of these mutations, you're more likely to be at risk. And if you get into a relationship with someone who also has a mutation in BRCA1 or 2, say a male and a female, and they reproduce, then it's likely that their offspring will have these mutations and pass it down the pedigree. It's very likely that women won't experience key distinguishing symptoms of ovarian cancer, hence the late diagnosis rates, preceded by low survival rates. However, if symptoms extend past a 2-week period, it's suggested to seek care for the possibility of having ovarian cancer. Symptoms can include discomfort with pain or pressure in pelvic, abdominal, or back areas, weight loss from difficulties with eating, or having trouble to put down food or feeling full too fast, going to the bathroom more frequently or urgent, or dealing with constipation or diarrhea, bloating, feeling fatigued, and unusual vaginal discharge or bleeding exceeding longer than 2 weeks. So when you haven't experienced such symptoms frequently, uncertainty pertaining diagnosis evolves, leaving a woman to progress through the stages of ovarian cancer more likely. So if there are suspicions of ovarian cancer, then early diagnosis can be achieved through a combination of exams and tests, such as pelvic exams, searching for ovarian masses. You could get blood tests of the protein CA125, which is an ovarian protein, and the blood test will measure the protein levels. So if you have increased levels of the protein CA125, then that means that you have a higher chance of having ovarian cancer. You could do biopsies, and then there's also genetic testing. And then from there, imaging exams, including various scans, will also help determine diagnosis. But it is key to remember that it's hard to acknowledge the symptoms if they're not that obvious. So it's good to pay attention to your body and what's going on. So next we'll talk about genes and pathways that are responsible for this ovarian cancer. A pathway that we're familiar with includes the PI3K pathway stimulated by RAS. And firstly, if you look at figure 2, a growth factor will signal and bind with a receptor. And then active RAS can activate indirectly PI3K, which forms PIP3 and then activates AKT. Then AKT and a rogue guanine nucleotide exchange factor then gets tethered to the plasma membrane, and from there, AKT and PKB can activate MTOR to stimulate cell growth. And considering HGSOC's commonality of P53 mutants, you can look at the pathway to the left when AKT goes and activates MDM2. In normal circumstances, MDM2 binds to P53 and brings it to the proteasomes to get degradation of P53. But in HGSOC, this is not necessarily the case. So the genes of interest are PI3K, P10, AKT, and P53, and it's linked to BRCA1 and BRCA2. Most importantly, I think that we should acknowledge the link between P53 and BRCA1 and 2, as they prevent double-strand DNA breakage and deal with cell cycle arrest and apoptosis. Furthermore, their defects are largely responsible for this aggressive carcinoma. Other genes that are suspected to be involved include MYC gene, NF1, RB1, P10, and the pathway of RAS and MAPK. So because high-grade serous ovarian carcinoma is so aggressive, treatments are usually just used to elongate the amount of time left after diagnosis. The best treatment option was considered to be cytoreductive surgery followed by chemotherapy. More previous investigations have acknowledged that targeted therapies can help with facing later mortality, such as polymerase inhibitors, inhibiting AKT signaling, and focusing on repairing double-strand DNA breaks. But again, ovarian cancer is really hard to target, and it's not easily detected. As always, it's very important to pay attention to your body and what it's telling you, and get genetic tests to know if you have a mutation in these genes, and also with your partner. And if you're female, try to reduce the risk of getting this cancer because it is fatal and the mortality rates are very high. But listed here are the references I used, and thank you for watching my presentation on ovarian cancer.